Cannabis sativa is another remedy having a strong action on the urinary organs, particularly upon the urinary tract or urethra. It is the remedy par excellence with which to begin the treatment of gonorrhea, unless some other remedy is particularly indicated, and such cases are very few. The most characteristic symptom is that the urethra is very sensitive to touch or external pressure. The patient cannot walk with his legs close together because any pressure along the tract hurts him so. If the disease is extended up the urethra or into the bladder, there will often be severe pains in the back every few minutes, and the urine may be bloody. I used in my early practice to put 5 drops mother tincture into 4 ounces of water in a 4-ounce vial and let the patient take a teaspoonful 3 times a day. After about 4 days, the inflammatory symptoms would have subsided, and the thin discharge have thickened and become greenish in appearance. Then, Mercurius solubilis, 3rd trituration, a powder 3 times a day, would often finish the case. Or, if a little thin gleedy discharge remained, I cured that with sulfur, capsicum, or kali iodide. I have cured many cases in from 1 to 2 weeks this way. Later I have used the CM potency in the first stage, and sometimes never have to use a second remedy. If I do, Mercurius corrosivus, CM, is generally the remedy. Sometimes pulsatilla, sulfur, or sepia is fit to finish up the case. There are exceptions, but the rule is that cases get well promptly under this treatment. After cannabis sativa, Mercurius corrosivus, if the discharge is thick and green, if the burning continues. Pulsatilla or sepia if the discharge is thick and bland. Sulfur for gleat. Of course, I have not mentioned all of the remedies that are necessary in this disease. I use them all in the CM, and I know, having tried both, that they cure better than the lower potencies. There is one curious symptom I have several times removed by this remedy, namely a sense of dropping around, or in the region of the heart. I do not know its pathological signification, but it is very annoying and the patient is very grateful to be rid of it.